They are nothing but kidney tray, especially used as per universal precaution protocol to transfer sharp instrument, and we can also collect specimens or fluids that come during the surgery. Our Kelly's forceps. So there are two parts. The inner one is the obturator. So this is the obturator, and the outer one is called proctoscope sheath. Our friend is now going to demonstrate how to insert it. So he's assembling it. So putting in Sims position, adequate local anesthesia. We put it, and the obturator is removed, and we see it through it. And there are two uses of it. One is diagnostic and another is therapeutic. In diagnostic we can see piles, hemorrhoids, and in therapeutic those surgeries we can do through it. So here this is our Balfour's self-retaining retractor. Here our friend is assembling the Balfour's retractor, and the one way to identify Balfour's retractor is so you can see here on the table all these are types of retractors. So this one you can see here there is a ring-like structure on the top of its handle, and the handle is quite broad, and there are hole in the handle which makes it light. And while assembling, so this is the process how you can assemble. You can see here back there is a clip, so you just rotate it and align it to the hole, then you can make it out. Could you help it? So our friend here, he is trying to open up. So this is the way. Now he is placing it back down. So this is the way Balfour's retractor is being assembled. So here what we have, this is the devious retractor. So how can we identify is that, so it has handle. So handle, it is broad. So its handle is broad so that proper grip can be obtained. And on the handle there is hook-like structure. So it also provides the greater grip. And you can see it is sickle shaped and it is broad, and this is used as a retraction, an abdominal retraction, or we can retract liver through it. So in those purposes we can use it. So you can see here, so these two are our devious retractor, so you can see it. So this here we have L-shaped Langenbeck retractor. So it is used in superficial retraction such as in hernia and superficial abdominal retraction. So you can see here there is hole in the between, so it makes the object light. And you can see here there is the handle, so we grab it, so it has better grabs. So this is the Langenbeck retractor. So till now we have studied three retractors. So here we have our Balfour's retractor, devious retractor, and this is our Langenbeck retractor. So this is our Morris retractor. So you can see it has a broad handle for proper grips and grabs, and there you can see there is hole, it keeps the object light. And you can see here it is the plate slightly curved, you can see, and you can do retraction like this way. So this is our Morris. So here we have two retractors which can be quite confusing. So you can see here one is more of curved one, and another it is more of flat on the top, and it is bent as if 90 degree, and it is more of curved in structure. So this one we have already talked, this is Morris retractor. However, this one is our Doyen's retractor. So this one is also Doyen's retractor. Okay, we are revising the retractor. This is DeForce self-retaining retractor. Here is the assembly of it, and this is the devious retractor, and Balfour's retractor. This is devious retractor, and this is Langenbeck retractor, and here we have our Morris, and this is our Doyen's retractor. Okay, in here, so this is our Langenbeck, which is L-shaped, and on the terminal end you can see here it is more of curved, which is for holding the tissue and retracting it, and this is our double L-shaped Langenbeck retractor. So this is our BP handle and BP handle blade, scissor blade, and based on 8 different scissors or blade can be used. And here you can see this is our towel clip, and it has got a special name, perhaps indeed Right now I am not sure of it. Towel, Mayos towel clip. So this is our Mayos towel clip, and we have a smaller clip also. We can find it, but it is not here, and that is Doi's towel clip. So be careful. This is Mayos towel clip, and this is BP handle. And you can see here two long uh, so you can see here it has got finger hole, and this is the shaft which is long, shank which is long, and it has box joint. And you can see here on the blade, would you like to open it? And on the blade you can see here it has circular type of endings with hole in the on both the sides. So it is called sponge holding or sponge holding forceps, and it is also used in case of holding the gallbladder. So while painting we use it especially during painting. So these three you can remember in a sequence. This is our while first we need to do painting. So for at first we need to have proper what do we say, before in the surgery field you make all those putting the clothes, and for that you can draping you use towel clip. This is Mayos towel clip. And then we have to paint where we are doing the surgical site, and for that we use Ramplay's sponge holding forceps, or it can also be used in case of holding a gallbladder. And this is our BP handle. So you can see here it has finger hole, and this is shank which is relatively quite long, and you can see it has box joint, and you can see the blade, it is slightly curved, and you can see here it has beak. And you might have seen this instrument in procedure rooms of surgery OPDs, and this is called cetal forceps. And previously nowadays it is used for taking out sterile gauze piece and using it while dressings or any other procedures. So this is our cetal forceps. So how you can know it? It is longer because we put it inside a cylindrical box in that there, and it has long shank, and it has blade which is big shaped, and for maintaining sterile we use it while transferring the sterile gauze piece. So we have here three forceps which are similar. So this is so you can see here it has a finger grip in it, and you can see here this is ratchet, and it has medium sized shank, and it has got box joint. And you can see on the tip of its blade, you can see there are like teeth structures. So you can see there, you can see it. It's not pretty zooming it out. Would you like to point it out, my friend? So you can see on its tip, that's there. So you can see serrations or teeth serrations, and this is called Ellis tissue forceps. So it is used especially to hold tougher structures like scalp aponeurosis while doing surgeries of palms, soles. So tough fascia structures, this instrument is used. Here there are two forceps we have here. These forceps are commonly known as dissecting forceps. So you can see there is quite difference in it. So you can see here there is tooth-like structure, and here you can see there is no any tooth-like structure. So the basic difference is here is toothed dissecting forceps, and it is non-toothed dissecting forceps. And this toothed is also known as Boney's dissecting forceps, and the another non-toothed is also known as de Baquet's dissecting forceps. So since it is tooth structures, so you can see here it has got serrations on its handle. So these serrations make it rough, and we can have better grip on it, because surgical field we have blood, fluid, so on. So while dissecting it, these these serrations provide us better grip, and you can see it is tooth. So especially tooth type of dissecting forceps, they are used for dissecting tougher structures like fascia, those structures we can dissect it. Whereas in case of non-tooth, you can see it again, it has serrations on its blade to provide a proper grip, and inside you can see here there is also serrations on the inside of the blade, and this is especially used for dissecting soft structures, like we can say callus triangle, or skin, holding skin, or just like holding soft structures like intestine, etc. Okay, here we have again our special structure. So you can see here I am putting my thumb on this hand, and I am putting my ring finger on this hand. So two fingers we keep it like this way while holding the instrument, and this is my index finger. So index finger, it comes near to the joint, and you can see here this is my mid finger, so it's providing grip in it. So this is the way how we handle the forceps or scissors or anything like these structures. And you can see here it is finger hole, and you can see here this is ratchet, and it has got box type of joint, and you can see here it has a special features on the blade. You can see here there is no tooth, but you can see here there is serrations. So in video I don't think it is yeah, you can see here it has got serrations, and on the inside you can see here there is a groove in it, and these serrations, they are particularly crisscross type of serrations, not like transverse or longitudinal serrations. So you can see these are coming like this way, obliquely crisscross like serrations is there. So it is especially used it is used for holding the what do we say, that needle, suture needle. So how to recognize it? So it has got on the top, on the beak, you can see here it has got crisscross serrations, and on the crisscross serrations it has got groove in it. So in this way you can identify it. You can see here we have two instruments. So you can see it has finger hole, it has shank, and it does not have any ratchet. And while looking at the blade, you can see it has blunt end in it, and there are no serrations or anything like that. So it is just simply scissors, and scissors you can see here it has a screw joint. So most of the scissors they come in screw joint, and this is Mayo's straight blunt scissors. However, here you can see here this is also a type of scissor, and it has also got a screw joint in it. So it has got curved curvature, so it is it is curved Mayo's scissor. Okay, so it also has blunt end. So this is Mayo's one. So you can see here this is also one of the teacher's favorite specimen or instrument. So you can see it has got finger hole, it has got a ratchet in it, and you can see here the joint is box type of joint, and on the blade you can see it is curved in it, and it has got a hole in it. So you see that. So it is called Babcock's tissue holding forceps, and it is especially used to hold the tubular structures. And you see that here it has got holes so that tissue comes out of it. So suppose, let's say suppose my finger it does not come out, but while you hold like intestine or something like that, tubular structures like fallopian tube or something, so certain part of that tissue comes out of it, so that there will no strangulation. So it is especially used to hold tubular structures, like it is used in case of appendectomy surgery to hold the appendix, and it is also used to hold the ureter or any tubular structures like fallopian tube. So this is also interesting and teacher's favorite. So you can see Babcock's tubular structure holding forceps. You can see here we have two instruments in it. So it has got finger hole, it has got ratchet, it has got shank, and you can see it is a relatively long structure. So you may be quite confusing with chital forceps. Here we have, so chital forceps, it is also long, however it is more heavier, it is more stout, and it has got curved at the beak. However, it has got it is curved in structure. And you see here in the blade, you can see here it has got serrations in it. However, it is vertical in nature. So all other forceps, if you see, suppose this is our forceps in it. So you can see this forceps, it has got transverse serrations. So you see it has got transverse serrations in it. However, it has got You see these lines are parallel to the blade, so it is going this way, not cutting perpendicular to the blade, so it is going this way. So this instrument, and in this instrument also you can see it has got ratchet, and you see here so it also has got that situation. So this is also one of the popular instrument known as lumen bowel holding forceps. So this way we hold the bowel and doing suturing and resection, so this instrument is used. So in case of like intestinal obstruction with gangrene and all those intestinal surgeries, we use these forceps. So this is simply bowel holding forceps. So you can see here we have 4 different types of forceps in it. So all these have got finger holes with ratchet, and now we are going to see the difference in them. So you can see here, so first of all we go with it. So you can see it has got ratchet in it and finger hole, shank, and this is box type of joint. And you can see here, so on its blade, so it has got transverse striations in it, so it is non-tooth. So it is simple type of forceps known as Kelly's artery hemostatic forceps. So this is Kelly's hemostatic artery forceps. So simply you can remember it as artery forceps or hemostatic forceps. So it has got straight blade. So straight blade it is especially used while navigating in narrow structures. However, we can find like curved type of end also. You can see here it has got curved in it. So curved, it is especially used so that you can see through it. So if it is curved, you can visualize it through the eyes and you can navigate the anatomy properly. However, if it is straight, it is especially used in case of narrow spaces, because curved they don't go into the narrow spaces, it would be difficult. But special feature of curved, it is that you have better visualization while navigating the anatomy. So this is also the similar type, which is a little bit longer one. So you can see, we can compare these 3. So you can see here, this is the longer one, artery hemostatic forceps. However, this is also curved one, which is medium sized, and you can see here this is straight blade artery forceps. So I put these 2 here for a while, and you can see we are talking about these 4 from the beginning, and you can see here these are relatively smaller in size. So these are those who are smaller, they are called as mosquito forceps. So yeah, there are 2 we have here. This is our curved mosquito forceps, and here my friend is holding, this is the straight mosquito artery forceps. This is a curved one, this is curved one, and this is a straight one. And you can see here now, so this is simple Kelly's hemostatic or artery forceps, and you can see here this is quite it is a forceps, types of forceps, but it has got special features. So what special features it has is that it has tooth structure. You see here, so what type of tooth it has is that there is 1 tooth, and there it has 2 tooth, and there is 1 gap inside of it. So so would you like to show? So 1 tooth is like this way on this side. So you see this is 1 tooth, and from the upper, so would you use another finger, like this finger, and yeah, in here on my hand. So you close it. So it has got like this way. So when it comes together, so it would be like this, interlocking in nature. And so this is what this is. Cock's artery forceps. So this is also popular instrument, and especially in previous days it was used in case of thyroid surgery for holding the upper pole of the thyroid, and nowadays it is used to hold like tougher structures. And this is Cock's artery forceps, Kocser forceps. So these 3 comparisons you can see. This is a small sized mosquito artery forceps, this is Kelly's artery or hemostatic forceps, and this is Cock's artery forceps. So here we have this is also 90-degree bent Kelly's forceps, hemostatic artery forceps. So you can see these are also longer one artery forceps, and this is straight blade artery forceps, and this is also straight blade artery forceps, and this is the longer one, straight blade artery forceps. So these comes on different size, So this is larger size one. So this is sorry, this is not arty forceps. So you see here these serrations, it has got vertical serrations. Did you see it? Yes, it is seen clearly. So if it was transverse, then it would be artery forceps. However, it has got vertical, so it is bowel one. So where it was previously. So these has also got vertical serrations in it. So this is bowel holding forceps. Okay, so you see it.
Yeah.